So, hello everyone, welcome to another session of. Welcome to another live session where we are studying Ellen's keynote, and it's been long. Wednesday, I was not able to come and do a live session. Today, we will be discussing another important medicine and from Ellen's keynote. And today is 6th of Jan and the counseling for AIPGT 2022 has been started since yesterday, 5th of Jan. And many of you who had asked, like they had their queries and doubts, I have tried to solve them, but I will upload one video where we will discuss all the queries related to the counseling. For now, today we will be discussing another important medicine from Ellen's keynote, that is IODUM. So we'll wait for a few minutes, let everyone join, and then we will start. So hello, welcome. Okay. So let's start with IODUM. Now the drug IODUM, the common name is iodine, and it was proved by Dr. Hahnemann himself. It is an element, as you all know, it is an halogen. It belongs to halogen group. Okay, so we are studying another important medicine from Ellen's keynote today, and that is IODUM. IODUM belongs to halogen group, and it is an element. It is an element, and the common name is iodine, and it was proved by Dr. Hahnemann himself. It belongs to class 6B or 7. In 6B, large quantity of alcohol is required, and in 7, it is for dry and insoluble substances. So, the IODUM, the peculiarity or the characteristic of IODUM, the person of a scrofulous diathesis with dark or black hairs and eyes, a low cachetic condition with profound debility and great emaciation. Okay, so whenever we are reading about IODUM, thing you need to know is that there is debility. Okay, there is weakness. Okay, there is prostration, debility, and there is emaciation. Emaciation we have already read about in the drug abrotanum, and we saw that lower extremities, marasmus or emaciation of lower extremities were marked in abrotanum. Okay, but here whole of body emaciated. Okay, so patient is scrofulous diathesis. Scrofulous diathesis means the glands are usually get affected. Okay, so diathesis is scrofulous, and the person is usually of dark hair and dark eyes, which is not a thumb rule, but it can be, usually is dark hair, dark eyes, and debility and great emaciation. It is compared with abrotanum. Okay, next, weakness. Okay, so there is great weakness and loss of breath on going upstairs. This is very important. So loss of breath. Okay, जब सांस भरने लग जाती है, सांस फूलने लग जाती है. Whenever the patient or the person is going upstairs, okay, he can come down easily, no problem. But when going upstairs, there is breathlessness and there is weakness. Okay, so it is compared with calcarea, because in calcarea also when going upstairs there is breathlessness. The problem is during climbing the stairs, and also there is great weakness during menses. Okay, remember this. So weakness and loss of breath when going upstairs, compare with calcarea carb, and weakness during menses. So weakness during menses, other medicines are alumina, carboanimalis, and coculus. Okay. In coculus, you will see that there is a weakness with leukorrhea. Okay, in coculus usually there is weakness with leukorrhea, and in carboanimalis there is weakness during menses. So in coculus also weakness, but it is leukorrhea, and leukorrhea is between mid period, like between menses, like before and after menses there will be leukorrhea, and leukorrhea, during leukorrhea the patient will be very weak. The medicine will be coculus, and in carboanimalis the patient will be weak. There will be weakness during menses. Okay, and same weakness during menses when the patient is menstruating. That time if she is feeling weak, very weak, so the medicine is iodum. Okay, so great weakness during menses, alumina, carboanimalis, coculus, and iodum. 4 medicines are there. Remember, whatever given in bracket is very important. You need to read it along with the medicine you are reading. Okay, main medicine. You need to read it with the main medicine and differentiate it. Then ravenous hunger. Eats freely and well, yet loses flesh all the time. Okay, like all emaciated medicines, like we saw in abrotanum, in tuberculinum, in natramure, sanicula, all this medicine, they eat well and they still loses the flesh, because whatever they are eating, the body is not able to assimilate it. So they eat freely and well, yet loses flesh all the time, and hunger is ravenous hunger. Okay, so it is बहुत ज़्यादा भूख लगती है, बहुत ज़्यादा खाते हैं, लेकिन many times there are mummies complaining to doctors that he eats so much but still the child is not gaining weight. He is like very lean, thin and emaciated. So that type of children or that type of patients usually requires iodum. And other medicines are abrotanum, natramure, sanicula, tuberculinum. Okay. Now another thing is empty eructations from morning to night, as if every particle of food was turned into air. Okay, so there are eructations, empty eructation. Patient is eructating whole day from morning till night, and patient feels that whatever he is eating, okay, each particle, imagine what he is saying, like each single particle of the food has turned into gas. Okay, so much of air or gas or flatulence he feels, and there is eructations, empty eructations. Okay, no food particle, no water brush, nothing, only empty eructations. And it is compared with kalika. Same thing is also in lycopodium, but comparison here is with kalika. Now he suffers from hunger. Okay, now what is the word you use? Suffers from hunger. That means the hunger is intolerable. He cannot tolerate hunger at any cost. Whenever the person or patient is hungry, okay, all his suffering will get aggravated. So he suffers from hunger. He must eat every few hours. Imagine, every few hours. He must eat every few hours, and still the patient is emaciated, lean, thin and emaciated. But he must eat every few hours. He is anxious and worried if he does not eat. Okay, so he will be very worried, he will be very anxious if he doesn't get to eat anything. And he need to eat every few hours, and there is suffering. Imagine, the word is suffering. Okay, not only discomfort or intolerance, not a light one. The suffering is greater, very greater. Means all his physical, mental suffering will be there if the person is hungry. Also, same thing is in Heena and sulfur. Feels ameliorated while eating or after eating when stomach is full. Okay, so he will feel better when he is eating, while eating, and during eating or after eating he will feel better. Now another important thing is itching. Itching will be low down in the lungs, behind the sternum, which causes cough. Okay, so this is sternum. Behind sternum, okay, the patient will feel like a tickling sensation. Okay, itching type feel hoga, and after that tickling or itching, the cough will start. Okay, and that extends through bronchi to nasal cavity, means it will start from here and then it will go up here till here. Okay, and there will be cough. Okay, so it is compared with coccus cacti, conium and phosphorus. So itching low down in lungs behind the sternum causing cough. Next is hypertrophy and induration of glandular tissue. This is important because the medicine has its action mainly on glands. So there is a hypertrophy and induration of glandular tissue. Glandular tissue means which tissues? It will be thyroid, mammary, ovaries, testes, uterus, prostate or other glands. Breast may dwindle and become flabby. Okay, what is the word? Breast may dwindle and become flabby. Hard goiter in dark haired person. Okay, if there is goiter, hard goiter, and the person is dark haired, so iodum is the medicine. But if the person is light haired, then bromium is the medicine. Okay, differentiating point. He feels better after eating. So general amelioration is by eating. So palpitation is worse from least exertion. It is compared with digitalis, and from least mental exertion is calcarea also palpitation. Now imagine, okay, let's first read, then we'll discuss. So there is palpitation. Palpitation will be worse from least exertion. Least exertion means physical exertion. Whenever there is little physical exertion, the patient will feel palpitation, and in iodum and also in digitalis. But whenever there is any mental exertion, okay, whenever there is any sort of tension, anxiety, worry, or whenever patient is thinking of anything, mental exertion will lead to palpitation in calcarea earth. So this is a comparison. Digitalis and iodum is for physical palpitation after physical exertion, and calcarea earth is for palpitation after mental exertion. Okay, now what is sensation? Sensation as if the heart was squeezed together, as if grasped with an iron hand. We have read already this symptom in which medicine? Can anyone tell? Sensation as if heart was squeezed together, as if grasped with an iron hand. Not exactly this, but this same kind of sensation was present in which medicine? We discussed earlier. Anyone? Yes, good, very good. Cactus. Yes, cactus is the medicine we read that he feels there is no room to beat. So, sensation as if heart was squeezed together. Squeezed. You can imagine the word squeezed. ऐसे दबा, ऐसे feel हो रहा है as if the heart is squeezed. And grasped with an iron hand. Suppose this hand is of iron, and in between this iron hand, this heart is squeezed. So what will be the feeling? There will be pain and the sensation. So that type of sensation patient is feeling. Okay, and same is in cactus and sulfur. Now how is the leucorrhea? Leucorrhea is acrid. Acrid, how you will confirm that leucorrhea is acrid or not? So you need to ask the patient whenever the leucorrhea or the discharge touches part of the body, like on the thigh or that part. So if there is any sort of burning or burning feeling, or there is pain, if patient says yes, so then the leucorrhea is acrid, and if patient says no, nothing happens, then the leucorrhea is bland. Okay, so this is how you need to differentiate it. So leucorrhea will be acrid. It is corrosive. You can imagine the word corrosive. Usually we use for acids and all, na, corrosive. So it is corrosive. Leucorrhea is corrosive. It's staining and corroding the linen. Most abundant at times of menses. Okay. Now, cancerous degeneration of the cervix, cutting pain in abdomen and hemorrhage at every stool. So there is cervical cancer, okay, degeneration or cancerous degeneration of the cervix, and there will be cutting pain in abdomen and there will be hemorrhage at every stool. So there will be bleeding at the time of stool or defecation, and patient will have cutting pain in abdomen and there can be cervical cancer. Okay, and with that there will be constipation with ineffectual urging, and which will be ameliorated by drinking cold milk. This is important. Remember this. Patient is having constipation, and but whenever he is drinking cold milk, he is feeling better. The constipation will not be there. So constipation better by drinking cold milk is iodum. Now crow, it is membranous, it is hoarse, dry cough, worse in warm, wet weather with wheezing and sawing respiration. So sawing respiration, we saw it is in spongia tosta. So it is also in iodum. And aggravation is in warm weather. Warm weather may if person is patient is having cough, there is hoarseness, there is the cough is dry and there is a wheezing sound you can hear ऐसे or wheezing is there. Okay, sawing respiration, the tool used for cutting wood. Okay, so if this is wood and it is done like this, the sound of that, okay, the saw, this is saw, that is called a saw. It has a teeth like structure is there. Okay, so that instrument or that tool is called saw and it is used for cutting wood. So whenever it cuts the wood, it produces a sound, a peculiar sound. Okay, so that type of sound is heard when you auscultate the chest of this patient, and that sawing respiration is present in iodum, and this is also a peculiar symptom of spongia tosta. Very dry cough, as if ऐसे घिसने जैसी आवाज आएगी. Okay, so respiration में wheezing and that sawing respiration. And then child grasps the larynx. Okay, it is an ileum sippa. And face is pale and cold, especially in fleshy children. Now you can see that fleshy children, especially what description we were reading till now, that patient is emaciated. Now the word is fleshy children. The child will grasp the larynx whenever he is coughing, because we saw that there is tickling or there is itching behind the sternum. Okay, and that will extend from bronchi till nasal cavity. So whenever there is tickling or there is cough, the child will grasp the larynx. Okay, essay, and then he will cough. And the word specially used is fleshy children. Okay. Now relationship. Now relation is complementary. It is complementary to lycopodium. It is compared with acetic acid, bromium, conium, calibicromium, spongia. All this medicine were in membranous croup and croupy affections, especially in overgrown boys with scrofulous diathesis. It follows well after Hepar and Mesarium, Hepar sulf and Merck is followed well by calibicromium in group. It acts best in goiter. When this is important, this is direct MCQ. It acts best in goiter when given after full moon or when the moon is waning. It is said by Lippe. And it should not be given during lying in period except in hypotensis. It is said by Henning. Aggravation is by warmth, it wrapping up the head. It is reverse of Hepar and Sorinum. Okay, so this is the picture of iodum. So iodum, you need to remember that iodum is a hot patient, very hot, thermally very hot patient. So all the conditions will be aggravated by warmth. Okay, so warmth is intolerable. Okay, and he is always better in cold air. So important first thing you need to remember is the patient is very hot, number one. Number two is there is hunger intolerance. Okay, he cannot tolerate hunger in any way. He need to eat every few hours. Okay, so hot patient, intolerance of hunger. Two important points. Okay. Third important point is emaciation. Okay, so he loses flesh. He eats so much, but still he loses flesh. Okay, and Phatak has given this in Phatak's Materia Medica, the description has been given that iodine, the element, it has absorbent property. So it absorbs that is why whenever the person whose muscles are wasting, okay, it is getting emaciated. If iodine is given as the medicine, it will be restored. The fat will be restored in the muscle. Though the iodine has the property, absorbent property, and that is why it absorbs the fat. And when given to the patient, it will restore the fat. So the person who is emaciated and who needs iodine, when given iodine, when prescribed well, he will gain weight. He or she can gain weight. So important, hot patient, hunger intolerance, emaciated. Okay, and it has scrofulous diathesis. What is scrofulous diathesis? That it acts on glands. Okay, so all the glands, glandular action. So iodine medicine, usually the action of the medicine is, number one is on glands. So all sort of glands in the body, like thyroid gland, like we saw ovaries, testes, prostate, mammary, everywhere it will has it action. And another important sphere of action of iodine is mucous membrane, and especially the mucous membrane of lungs gets affected. Okay, so these are the two important sphere of action of iodine. And scrofulous diathesis, as we said, that it will act on glands, and it will cause hardness of the gland. First there will be hardness of the gland, and after that it will become like loose. Now here we saw one symptom that there will be, the breast may dwindle and become flabby. So first there will be hardness, and after that it may dwindle and become flabby. And so you can use it in thyrotoxicosis or in goiter cases, thyroid cases, especially in every thyroid cases iodine can be used, because the common symptoms like constipation, palpitation, all these are covered within the medicine. So in palpitation is there, and the palpitation is because of any sort of physical exertion. Physical exertion will lead to palpitation. Other medicine is digitalis, and it is compared with calcarea ers, where mental exertion will lead to palpitation of the heart. Okay, this is important. And there will be leucorrhea. Leucorrhea will be very acrid. Okay, it will stain and it will corrode the linen. Okay, and there it is useful in the cervical cancer, cancer of the cervix. And another important point is weakness. Yes, of course, weakness is important, and the person will feel breathless. Okay, whenever he is going upstairs. It is compared with calcarea carb. And there will be constipation, ineffectual urging, and which will be ameliorated by drinking cold milk. And cough in fleshy children. Whenever patient is coughing, child is coughing, he will grasp the larynx with his hand. And there will be dry cough, and there will be wheezing and sawing respiration. It is compared with spongia tosta. So the complementary medicine of lycopodium is the complementary medicine of iodium is lycopodium, and it is compared with acetic acid, bromium, conium, calibicromium, and spongia in croup or cough, and Hipar and Merck. And Lippi has said that this medicine, iodum, it will act best in goiter. Okay, when given after full moon. After full moon, or when the moon is waning. Means after full moon, of course the moon will wane, that it will become small, small, small. So when this time, from like what we call that full moon is Punnam. So from that period, from Punnam से last next जो अमावस होती है, that duration, when during that duration if iodine is given to goiter patient, it acts with the best. Okay, and it should not be given during lying in period. What is lying in period? Anyone? What is lying in period? What is lying in period? Anyone knows? not it is related to pregnancy, but not exactly the pregnancy period. Lying in period is post pregnancy, like postpartum जो period होता है after delivery. Okay, after delivery of the baby जो period होगा, that period is called as postpartum period or lying in period. Old word is lying in period. So postpartum period. Okay, lying in period is postpartum period, means after delivery. So after delivery, the iodine should not be given. This is said by Herring. And if it is required, like the condition of the patient is such that it is requiring iodine medicine, then it should be given in hypotensive. Okay. And yeah, and that is said by Herring, and this is direct MCQ in exam, so you need to remember this. And it can be asked like for which medicine it is said, or it can be asked like who said this. Okay, both ways. So aggravation of iodine is by warmth because hot patient, and wrapping up the head, and reverse of heparin sorina. Okay, because so warmth will cause, wrapping up the head means warm, गर्म ही होगा ना, गर्म acid wrap अगर head कर लेते तो it will cause warmth only, so and that will aggravate the condition. So he is always better by cold. Okay, so open air, cold air, cold milk you can see. Okay, so everything he wants is cold. So this is in a nutshell about iodine. It was proved by Dr. Hahnemann. So yeah, that is all about iodine. You can ask anything, any question related to iodine. Okay, any doubt? Anything you would like to ask? Okay, so let's see what Boric has written about iodine. So he says that iodine arouses the defensive apparatus. Arouses means it increases, उठाता है. Arouses the defensive apparatus of the system by assembling the mononuclear leukocytes whose phagocytic action is marked at a given point. What does this mean? Okay, what does this mean? That he's saying that iodine has this property of increasing the WBC count. Okay, increasing the immunity of the body, defensive apparatus, and here the word typically is using mononuclear leukocyte. So iodine has capacity of increasing or raising the count of mononuclear leukocytes. Acute exacerbation of chronic inflammation. Whenever there is any chronic inflammation in the body, and if there is acute exacerbation, iodine is useful. It acts prominently on connective tissue, constant motion of eyeballs, acute nasal engorgement associated with high blood pressure, cold extend downward from head to throat and bronchi, acute affection of respiratory organ, pneumonia with rapid extension. Okay, the word is rapid extension, yani fast it will pneumonia will spread very fast. Okay, and right sided pneumonia with high temperature, and constipation with ineffectual urging, better by drinking cold milk, and dark yellow green urine is dark yellow green, dwindling of mammary gland, nodosities in skin of mammary, child brass throat when coughing, adenoid vegetation, tincture internally and locally to swollen glands, and rattlesnake bite. Okay, so whenever there is rattlesnake bite, you can apply it locally. The tincture can be given internally as well as applied locally. And pulsation in large arterial trunk. The complementary is lycopodium and badagia. Okay, so that is all about iodine from this Borix Materia Medica. Okay, tell me. Any question? Remember the relationship section, complementary medicine, and these two lines important written by two different authors about IODUM. This is important. For practice also you need to remember, and for MCQ also this is important. So remember this well. Now it's where we can see in many medicine description has been given about medicines, like just now we saw in iodum that it is suited to the person with dark hair and dark eyes. Okay, this is not true every time because it will act and also it is for casetic emaciated person. This is too important. But whenever this description is given for the constitutional treatment, uh, this is what they saw during proving, but this is not a thumb rule. If the other symptoms are matching and the eye color or the hair color is different, still it will act. Okay, so that is not a thumb rule. But during proving, many provers had been having like iodum during proving of iodum. uh, it must have been that many provers were having dark eyes and dark hair, and that's why they have noted down that symptom. And it can be possible these days also, but if it is not there, so this is not like you should not prescribe medicine. You can still give the medicine and it will act. Okay, so we can see description of many in many medicine, different description of the person has been given, like in phosphorus and pulsatilla, many medicines. Okay, bromium, and you need to remember this description, because in practice it is useful many times. Because many times if there is typical features present in the patient, you can directly go to that medicine and match that symptoms with the patient. And also this is important for in the view of MCQ for exams also, because in exams directly question can be framed and asked on the description only, like okay, tell me adapted the you have to tell me the name of the medicine, that it is adapted to persons with black hair, dark eyes and dark complexion. Okay, so you can imagine how is the person that is having black hair, the eyes are dark, and the complexion is also dark. Okay, samjha? Now options. Option A is nitric acid, option B is sulfuric acid, C is carbolic acid, and D is muriatic acid. Now tell me which is the answer for this. All dark, dark hair, dark eyes and dark complexion, and all acid medicines are given in under option. So which is the correct answer? A, B, C or D? A is nitric acid, B is sulfuric acid, C is carbolic acid and D is muriatic acid. Okay, tell me which is the correct. Okay, so we are reading this from Allen's Keynote. Okay, so this description should be there in Allen's Keynote under that particular medicine. Okay, more answers. Nitric acid, sulfuric acid, carbolic acid or muriatic acid. Dark hair, dark eyes and dark complexion. Anyone? Correct. Good, good. Kanupriya, yeah. So the answer is muriatic acid. Muriatic acid is having dark hair, dark eyes and dark complexion. Okay, and this exact line is written in Ellen's keynote. Okay, next is, tell me, it is adapted, this is easy actually. Adapted to tall, slender persons of sanguine temperament, fair skin, delicate eyelashes, fine blonde or red hair, quick perception and very sensitive nature. Okay, tell me. The person is tall, the person is slender, means slim and trim. Okay, fair skin with delicate eyelashes, fine blonde or red hair, and the person is quick in perception and very sensitive nature. Okay, so options are A. Bromium, B. Lobelia, C. Phosphorus and D. Tuberculinum. Okay, yeah, good. So this description is of phosphorus. Okay, so always remember tall, slender, long eyelashes. Okay, quick perception. All this is description of phosphorus. Remember. Hmm? Then another one is adapted to light hair. Okay, it is adapted to light hair, old people, especially women, flushes of heat in climacteric year. Okay, there is flushes of heat in climacteric year. Options, let's see options first. Okay, so question repeat, I'll repeat the question. It is adapted to light hair, old people, especially women, flushes of heat in climacteric years. Okay, in climacteric years. Option is sulfuric acid, B. lachesis, C. sanguinaria and D. sulfur. Tell me medicine. Sulfuric acid, lachesis, sanguinaria, sulfur. Climacteric. Flushes of heat in climacteric years. Climacteric is menopausal years. Okay, more. So this is what happens. We jump to medicine directly. Right. John, answer is correct. Sulfuric acid is the medicine. So this is what happens by seeing only two points at climacteric years and flushes of heat. Like this is we can think of, but the exact line is written in under sulfuric acid. So correct answer is sulfuric acid. Okay, read it in Allen's keynote. So this description is very important. So for every medicine there is a description. When description has been given, and you need to read it very carefully and remember it, and associate it. Try to associate that with the medicine. That way you will remember it for long. Otherwise it is very confusing, because so many medicine has somewhat similar description. Okay, now tell me, adapted to large persons. Okay, remember the word adjective. Whenever they are using, you need to remember them very well. Here the adjective uses a large person. So adapted to large persons, inclined to obese. Already the person is large and it is inclined to obesity. It acts better in children than in adults. Okay, so whenever there is obesity in children, this medicine will be useful. Which is a medicine? Medicine option A is Heena, B Kali bichromum, C sulfur and D Kali brome. Two options are there, Kali bichromum and Kali brome. Tell me. Heena, Kali bichromum, sulfur, Kali brome. Good. Correct. So the correct answer is Kali Brome. Kali Brome is suited to children, obesity in children than in adults. Okay. The word, remember, large. The word is large persons. Okay. Large person is Kali Brome. Okay. Then adapted to pale, lean persons with lax, flabby muscles, face is pale and waxy. Try to picturize this, whenever visualize this whenever we are reading this description. How will be the person? Waxy means oily. Okay, the face will be very dull, not very fresh. Pale, it will be very oily. Waxy. Shiny means, like, oily means shiny. Waxy. And the muscles, the person will be very lean. Okay, and the muscles will be very lax and flabby. Which will be the medicine? Options. Option A. Now here you should, try to use your understanding of the medicine. Option A is acetic acid, B is petroleum, C is lobelia, and D is lux vomica, which is the medicine. Lean, pale, waxy. Acetic acid, petroleum, lobelia, yes, and lux vomica. So the correct answer is acetic acid. Correct. Good. Acid groups are always weak. Okay, so always weak, always lean. These two things associated with acetic means all acid group. Particularly here the answer is acetic acid. Very good. Remember this description well. Okay. Okay, tell me now, adapted to persons with light hair and skin. Okay, so the hair will be light, skin will also be light, but the person will be very irritable, very quarrelsome. So irritable and quarrelsome disposition, easily offended at trifles and vexed at everything. So person is good looking, the light hair, light skin, but he is very irritable, he is very quarrelsome. हर छोटी छोटी बात पे चिढ़ जाएगा, झगड़ा करेगा. Okay, so easily offended. Okay, easily offended at trifles. Trifles means like very small things. So he will get easily offended at trifle and he will be vexed at everything. Okay, remember this description. एक बहुत अच्छा दिखने में है कोई person, बट बहुत चिड़चिड़ा सा है. हर छोटी छोटी बात पे चिढ़ जाएगा, हर छोटी छोटी बात पे गुस्सा करेगा, झगड़ा करेगा. Okay, remember this description. Now options. Option A is China, that is cinchona also. Option B is petroleum. Option C is Sina, and option D is all of them. Okay, remember this. China, and whenever you are reading, read very carefully. The option given A is China, option C is Sina. Only H is different. So read very carefully. And China means cinchona. So don't get confused. Okay. So option A is China, option B is petroleum, C is Sina, and D is all of them. Tell me. Good, right? Petroleum. So the correct answer is petroleum. Okay. So what to do to remember this now? This exact description, read it, and we all have many persons whom we know, such persons, friends, family members, anyone. Yeah, correct answer is petroleum. So anyone or friends, family member in group, wherever, and wherever you find such person, the person is having same characteristic like given in this medicine or described under this, recall that name. Okay, whenever you have one friend who is like good looking, nice, good skin, but he's very irritable, he's very quarrelsome, so he's petroleum. Okay, so remember that way. So whenever you will read this question again, you will recall his name, that your friend's name, and you will remember that answer. That answer is petroleum. So start calling that friend petroleum, so answer will, you can recall it very quickly. So because you need to apply all these tricks, so that you can recall it very easily. You can remember so many things at one time. Mnemonic and all these things plays very very important role, and this helps you to get more marks and remember more things. Your memory gets sharpened with all these tricks, so you need to use them and apply them daily and in all subjects. Okay, it will be very helpful. Okay, then, okay, this is very easy. I'm not going to give you option for this also. So this is adapted to thin, irritable, careful, zealous persons with dark hair, bilious or sanguine temperament, disposed to be quarrelsome, spiteful, malicious, nervous, and melancholic. Okay. Anyone without option who can answer this? Good. Very good. Okay, with options, let's see. With option A is Ignatia, B. Staphysagra, C. Bryonia, and D. Nux vomica. Okay, which is the medicine? Thin, irritable, careful, and zealous person, dark hair, bilious. Okay, so the correct answer is yes, Nux vomica is the correct answer for this. Remember, the person is thin, he is very irritable, okay, but he is very careful. Okay, you can see fastidious, he is fastidious. So he is very careful, he is very zealous. Okay, means he is very excited. Okay, just a minute. Yeah, the correct answer is Nux vomica. He is very careful, he is very zealous, but he is at the same time very irritable because he is very workaholic. And the person who works too much gets usually are very irritable because they lack sleep, they don't eat properly, and all such things. So yeah, these people are very quarrelsome, spiteful, malicious. Nux vomica. Okay. Then after this, let's take two more and then we'll stop. Okay. Mm, and same questions will repeat tomorrow without options. Well, let's see how many of you will remember. What about hyperacidity? Okay, so tell me. It is adapted to persons of dark hair, rigid fiber, but mild and easy disposition. Now you can see the person here is very dark hair, and he is having digit fiber, but he is very mild, and the disposition is easy going, ekdam chill pill. Okay, so easy disposition. So who is the person? Option A, sepia. Option B, Cilicia. C, Platina. And D, Stana Metallicum. Okay, so what is the answer? Dark hair, rigid fiber with and easy disposition is answer is sepia. Okay, the correct answer is sepia. We have saw that sepia is very irritable and all, but in Ellen's keynote first line you can see that the person are mild and easy disposition. Okay, till you irritate them, they are very good. Okay, so that is about it. Now the last one will take. Okay, so this is adapted to women of thin, scrawny, feeble, cachetic appearance, irritable, nervous temperament, pale and sunken countenance. You can imagine the woman, thin, very scrawny, very feeble, very cachetic and irritable, nervous. Options are sepia, B, platina, C, selenium, and D, sickle core. What are the medicine? Which is the medicine? Correct. So remember the description: thin, scrawny, irritable, feeble, yeah, and sunken continence. The word, remember this word, sunken continence. Okay, sunken continence is sickle core. SCSC. Okay, sunken continence, sickle core. Remember this. Okay. So answer is sickle core. Yeah, correct. Sickle core is the correct answer for this. Good, good. Very good. So yeah, that is all. And regarding, someone is asking about hyperacidity. So there are many medicines. Okay, so only with the, when you say that prescribe medicine for hyperacidity or for joint pain or such things doesn't happen in homeopathy. That is why it is homeopathy. Individualized treatment is given. If there is hyperacidity, you need to take pan 40 and all is allopathy. In homeopathy, just by the name of medicine, we usually don't prescribe, and you need to take complete symptoms of the patient. You need to consider whole case, whole history of the patient, and accordingly we can prescribe the medicine, and then only the medicine will be useful, and then only it will help patient to get rid of his problem. So if there is anyone or suffering from such thing, consult a nearby homeopath, I would suggest, or at least give me complete symptoms whatever the person is feeling, not in live session. You can message me, you can DM me on Instagram, or you can mail me, and then only I will be able to help you. Okay, I think it is Indradev or someone, you have also commented, but such thing doesn't happen. Only on name of disease we cannot prescribe, and even if we prescribe, that prescription will be a total fail. Medicine will not work that way. So you need to give complete symptom, complete detail of the patient, and then only I will be able to help you. Okay, so yeah, that was all for today. Remember IODUM and all this description of different medicines, and I hope this session was useful, and let's meet not tomorrow, we'll be meeting on Monday, yeah, directly on Monday, but I'll be uploading some interesting videos in these 2 days. So hopefully you all will like it. Other subject, yes. So yeah, next week probably we'll start something. And okay, now how many people are there? How many of you want me to start with other subject, and particularly with the, I think, which is difficult more? This is more difficult subject. Most difficult, I would say. Yeah, medicine is one I know. Other than medicine, which subject you would like to discuss? Practice of medicine is one. Surgery is okay, but it is not that scoring. Okay. What I told you that time, that focus more on the subjects which are more scoring first. You should not ignore other subject, but focus more on the subjects which are scoring, more scoring, because limited syllabus is there, and you can score more with that, like obs gynec, FMT, pharmacy, repertory, or organ, and even these are all scoring subject because the syllabus is limited, and you surely know that इतने में से ही कुछ ना कुछ क्वेश्चन पूछा जाएगा. And in surgery, anatomy, physiology, in practice of medicine, the syllabus is so vast, and you can't even guess from where they can ask you what question. Organ is important, and scoring as well. Okay, so we will, I think, we can discuss between this organ and repertory, or in allied, I think, FMT or obs gynec. Between this we'll start, and then we will proceed to other subjects. Okay, so on Monday let's see how it goes. Okay, so thank you so much for joining. For any queries, any doubt, you can comment down anytime below. I'll try to answer. Lecture? How? What lecture? Discussing medicine is lecture. What else to do? Yeah. Okay. And meanwhile, I'll be uploading that rubric hunting videos. So that will be helpful as well, because rubric hunting is usually asked in repertory. So you should know single, medicine rubrics you should by heart. So yeah, that's all for today. Thank you so much for joining. Take care. Bye bye. Good night.